Clinical Pearls, brought to you by Medicom Oncology.
Welcome to Managing Myeloma. I am Dr. Jacob Laubach, and I'd like to briefly review the topic of post-transplant consolidation therapy. Post-transplant consolidation refers to the practice of administering typically 2 or 3 drug treatment regimens in the aftermath of transplant in an effort to deepen the response and lengthen the response to treatment. The CTN StaMINA trial, which was reported on at the 2016 American Society of Hematology meeting by Dr. Statmauer and colleagues, sought to evaluate the impact of consolidation therapy in patients who had undergone transplant and determine whether this practice actually improved outcomes in comparison to patients who received lenalidomide maintenance alone. In this study, patients were randomized in a 1-to-1-to-1 fashion to receive in the aftermath of transplant either single-agent lenalidomide as maintenance therapy, a standard of care, versus 4 cycles of consolidation therapy with the 3-drug regimen of lenalidomide, bortezomib, and dexamethasone, followed by maintenance with single-agent lenalidomide, or to a second autologous transplant, which is referred to as a tandem transplant, followed by lenalidomide maintenance. In this trial, there was no difference across the 3 arms in terms of progression-free or overall survival. With that in mind, I would consider post-transplant lenalidomide maintenance to be the standard of care, recognizing that by giving a single agent as maintenance, one is limiting the impact of treatment-related side effects while at the same time deriving benefit from the use of ongoing immunomodulatory therapy. I think it is true that longer follow-up of the CTN StaMINA trial is necessary to determine whether differences across the 3 arms emerge that would be informative to our clinical practice. And it's also very important to recognize that there may well be certain populations of patients with multiple myeloma who have particularly high-risk disease by virtue of cytogenetic findings such as complex karyotype or 17p deletion, or those with highly aggressive clinical characteristics who may benefit from consolidation therapy and even ongoing multi-agent maintenance therapy. Thank you for listening.
Don't forget to subscribe to the Medicom Oncology podcast channel for more clinical pearls. And be sure to visit managingmyeloma.com for more practice resources.